Hello, I'm Christina. I'm a student physical therapist from Anderson University. I'll be working with you today.
Hello.
And your name is?
Kathy.
Okay, nice to meet you.
Nice to meet you.
So what we're going to be doing today is an abdominal exam. And with this, I'm just going to be looking at the skin, listening to your bowels, and just kind of feeling around a little bit. Is that okay?
Yes.
Okay. So for this exam, I am going to be exposing your abdominal area. Is that okay?
Yes.
All right. So before we get started, do you need to use the restroom?
No.
Okay, great. If you could lay down on your back for me. And for this, you can either lay with your legs straight or your knees bent, whatever is more comfortable. Okay. I'm going to lift your shirt up. Is that okay?
Yes.
Okay. Still okay?
Yes.
Okay. And then you pull your pants down a little bit, but I will drape with this towel, okay?
Okay.
So for this first part, I'm just going to do a quick skin inspection. I'm looking for any bruises, any scars, any hernias, any masses, any pulsating masses, and just general symmetry, which everything looks okay. So for this next part, I'm just going to be listening to your vowel sounds, okay?
Okay.
We'll pick it up a little bit. Let's go. So we'll be listening in each of the 4 quadrants of your abdomen. Just listening for general vowel sounds, which would be normal to hear them. To the right upper quadrant, left upper, and then left lower. Okay, everything sounds great. So for this next part, I'm going to be doing what we call percussion, which is just going to be me lightly tapping on your organs. I'm going to be listening for basically 2 sounds, tympani and dullness. Tympani is just kind of a high-pitched sound, and that's going to be mainly what I hear because that's due to air, which is mainly in your stomach and intestines, and the dullness would indicate more organs, which would mainly be like your liver or just fluid-filled areas. So I'm going to do all 4 quadrants again. The tympani sound, your intestines. So move up to your liver, more of a dull sound. Left upper, more dullness, or tympani. Left lower, more tympani. Okay, everything sounds good. So for this next part, I'm going to be percussing for the size of your liver, okay?
Okay.
Pull this up just a little bit. Like I said earlier, your liver is going to have more of a dull sound, so I'm going to listen between where the tympani changes to the dullness to kind of get that measurement. So I'm going to start in the midclavicular line below the belly button, listening for that change in sound. So tympani, the dullness right about there. Be the lower border of your liver. Your upper border. Take a quick measurement of that. Okay, so that is about 6.5 centimeters, which is in the normal range. Okay, so for this next part, I'm going to pull your shirt down really quick. If I could have you sit on the edge on this side of the table. Okay, so for this, I'm going to be percussing on your kidneys, okay?
Okay.
I am going to lift your shirt up. Is that okay?
Yes.
Okay. Like I said, here we're going to be percussing for your kidneys. So I'm going to come under your 12th rib, just lateral to the spinal cord. All right, I'm going to percuss on the kidney. Any pain?
No.
Okay, same thing on this side. Just lateral to the spinal cord, same thing. Okay, any pain?
No.
Okay, good. So if you were to have pain there, that could indicate inflammation of your kidneys. Okay. So to continue, if I could have you lay on your back again. Pull your shirt back up. Is that okay?
Yes.
Okay. For this next part, I'm just going to be feeling around in your 4 quadrants again. So I'm going to start with some light palpation, starting in your right lower quadrant. So the organs here would be mainly your appendix, and also your large intestine, and also your reproductive organs. And then moving up to your right upper quadrant, which would be your liver, your appendix, and more posterior would be your kidneys. Moving to your left upper quadrant, which here could be your stomach, and also your large and small intestine. And then your left lower, again your small and large intestine, and also your reproductive organs. Everything okay?
Yes.
Okay, now I'm gonna go a little deeper, okay?
Okay.
So for here, I'm looking for any guarding, any pain, any tenderness, looking at her face to see how she's tolerating it. Just feeling for any abnormal feelings beneath my fingers. You okay?
Yes.
Okay. Okay, no pain?
No.
Okay, good. So for this next part, I'm going to be palpating for your abdominal aorta, which is just the big blood vessel which runs in your stomach. So I'm going to feel for the pulsation and then measure where that pulsation stops. Here. That is about 2 centimeters, which is what we want. We want that to be less than 3 centimeters. Anything greater than 3 or closer to 5 could indicate an abdominal aneurysm. Okay, so for this next part, just a little bit, I'm going to be assessing for McBurney's point. So McBurney's point is going to be, I'm going to find your ASIS, and then your umbilicus, and then about 2/3 from your umbilicus to the ASIS, which is about right here, is McBurney's point. So if I were to palpate and if she had pain on the rebound coming back up, that would indicate appendicitis. So if I were to palpate and then she had pain while coming up, that would indicate appendicitis. So now for our special tests, we'll do Rosling signs first. So for this, I would go to the left quadrant, do a slow, deep palpation. Any pain?
No.
Okay. So if she were to have pain in the right quadrant, the right lower quadrant, that could indicate peritonitis, which is just inflammation of your stomach lining. So for the next one, we'll do the psoas test. If you could bring your leg up for me, bend your knee. Okay, I'm gonna try to bring your leg down. Don't let me move it, okay?
Okay.
So go. Okay, any pain?
No.
Okay, good. So if she had pain in her right lower quadrant, that could indicate, that would indicate irritation of her psoas muscle, which would indicate the appendix could be irritating it from inflammation, so it could indicate appendicitis. So for the next one, go ahead, relax your leg. I'm going to be moving it. So for this one, I'm going to passively internally rotate her hip. Okay, any pain with that?
No.
Okay, good. So for this test, if she had pain in her right lower quadrant, again, that could, the obturator muscle could be irritated from the appendix, stemming from appendicitis. So pain there would be appendicitis. So for our last test, we'll do Murphy's sign. So for this one, I'm going to come under her 12th rib. Okay, breathe in. And exhale. Okay. And do a deeper palpation, and then I want you to take a deep breath in, okay? Any pain with that?
No.
Okay, good. So if she were to have pain on that deep inhalation, or she'd just stop completely with pain, that would indicate inflammation of the gallbladder. Okay? That wraps up our abdominal exam. Go ahead and sit up for me. All right, it was nice working with you.
Thank you.
9:50.